a big question, and, one that is not taken lightly. So this big question is, why is chemo sometimes recommended to Gerson patients when people are wanting to heal naturally with the Gerson therapy?
So sometimes chemo can be recommended or suggested. It depends on the stage of the cancer and how fast the disease is advancing, and also if the patient requests for chemo to be included. Gerson is a slow healer. Sometimes there is no time to heal. And when the disease is advanced, that's when you really need to buy some time. So other adjunctive treatments like chemo or oncology targeted drugs might be indicated as a stepping stone to achieve a greater overall survival, because that's the bottom line. Can you live a long time or survive through this or even achieve remission status? This gap, that the time that it takes for Gerson to heal and the speed of the disease progression, that gap has to be bridged. And so this is why sometimes conventional oncology care can really help to bridge that. And for the entire goal, of course, is to completely go to natural approach after this initial bridging. And it's not meant to be permanent. It's just exceptions. Chemo is like a double-edged sword. It can shrink tumors, but the residual disease can be worse than the original since it has survived the chemo drug. These cancer cells are mutated and strong. And at the same time, they have developed secondary resistance. So they're surviving, and they're known as minimal residual disease. At the same time, the patient's immune system has already weakened as a result from the side effects of chemo. So when you have a weakened system and you have a much stronger cancer surviving cells, you can imagine how fast they can come back. That's why it has to be applied properly during or with the Gerson therapy. For slow-growing cancers, natural approaches tend to be the better option. So it really depends on what the Gerson practitioner sees at the time of initial consult. And then these therapy strategies are discussed.
Hearing, when in some cases we ourselves may support them in the decision to take and do sometimes chemotherapy. As we always say, the stage and grade of the disease, the individual condition, there are many factors that would decide if one of the patient may need chemotherapy.
Have you guys experienced as well people that may detox too quickly, maybe while they're on chemo or when they have just had chemo?
Yes, absolutely. We really need to watch those patients who finished chemotherapy without our support, because they would start detoxifying very fast. So that requires a nice gradual introduction into the Gerson therapy. And as a typical example, I can tell you that, of course, we cannot measure exactly what type of chemotherapeutical residues are coming out, yes? But what we can see are the symptoms and the feedbacks from the patients. They start smelling the same smells. They start having the same symptoms. And the very expressive symptom is when somebody has been treated with platinum-based chemotherapy, then the nails become often black because of the poor circulation. And years later, when we put them on Gerson therapy, they start showing again black nails and things. So really, it's a proof that there are old residues sitting in the cells and poisoning the cells. So we need to be very careful, yes, after chemotherapy, how to introduce them. And well, as I said, during the chemotherapy, it's very individual, very typical schedules are following each other. And now the practitioners can work very carefully and consciously with each different chemotherapeutic substance. It's very different.
Thank you for that explanation. I think that's, really something that people need to hear, especially from, an experienced practitioner, Gerson practitioner that has been doing this.
First of all, just to reiterate that it is the choice of the patient. So we can advise, we never push people either way. They have to take responsibility for that decision. So that's the first point. Just to give you a couple of examples where we might consider or discuss chemotherapy with the patient. And these are real examples. Okay, so what happens if you have a grade 3 tumor, very, very aggressive tumor pressing on a major artery? That's a grade 3 tumor. That's going to double potentially in 3 months. That's going to block a major artery. That will most probably have the person in ER. They may not survive an incident like that, okay? Another example, what if it's a large tumor inside the colon? Again, could be a grade 3, doubling very quickly. The colon suddenly blocked, okay? They're going to be in ER. They're going to need a huge surgery, an unplanned surgery, major resection of the bowel, stoma, etc., etc., etc. So what if we can use combination of the chemotherapy, Gerson therapy, to reduce that tumor until it's manageable, until the Gerson therapy can take care of it? And also, what if we would really love to perform a surgery or to have the doctors perform a surgery, but the tumor is too large to perform the surgery? So that could be a 3-4 centimeter tumor there. The doctor's saying that's inoperable unless you have the chemotherapy first to shrink the tumor, okay? So then the strategy becomes take the chemotherapy, shrink the tumor, have the tumor removed surgically, then we can put you on a good level of Gerson therapy. So those kind of cases we're facing every day of the week.